like to be called Ben. I'm also a physician, so professionally I'm Dr. Bierman. I'm a psychiatrist, but to close friends and family, everybody else I know, I'm Ben.
And where do you work?
I work at the University of Michigan. I'm a psychiatrist, and most of my work is in our psychiatric emergency service.
What would you say are some of the gaps in the system of getting people in off the streets into long-term recovery?
Well, sometimes there is a wait to get into recovery because there's a limited number of beds, and if there isn't a space, then we have to figure out what to do with patients in the meantime. Unfortunately, some of the options we used to have, like places where a patient could safely stay for a few days and get some support. There was a place called the Engagement Center for patients who were motivated for treatment but didn't have a bed at a local detox center or a longer-term recovery center. They could go there, get support.
Why do you think that gap hasn't been filled?
Well, funding is a big issue. A lot of the funding cuts that occurred with the current administration, quite literally, one day we had the engagement center and the next day we didn't. When we see people in the emergency room, they either stay there for several days and take up space, and it's really not the appropriate level of care. It's after 2 or 3 days and somebody's been waiting around and they don't have a bed at detox, they lose their motivation and they begin to go through withdrawal. And so they go back to their pattern of use on the street. The engagement center and places like that was a safe haven where we could send people to get some food, get some support, get some short-term counseling, meet some other individuals in recovery, and to kind of keep that motivation and engagement going. Without that option, a lot of our patients are going back out on the street, and it's a vicious cycle. We see them coming back, and if they survive, this addiction, as we know, has a high mortality rate, especially with fentanyl and some of the more potent substances that are out on the street.
Do you think it would be beneficial for U of M to put some funding into like an in-between space?
Well, I don't. Certainly. I mean, if anybody could put, and fund an engagement center, but, a big hospital like the University of Michigan, addiction is a big problem, and there's an addiction treatment service for patients who are medically compromised, but it's the patients that aren't in the system, they're not admitted to the hospital, they're just in the emergency room. I would say we can support them, but funding a center for it, just hasn't been a top priority.
And I was told that they don't have necessarily a detox center at U of M. It's more like it's a service. So you might be in oncology and doing detox, or you might
you might be in the emergency room getting some medication to treat your symptoms, or admitted medically, especially for folks who have alcohol use disorder, because that detoxing from alcohol, many people might not realize this, can be deadly. It's one of the more deadly substances to withdraw from, and so sometimes if patients have a history of seizures or complicated withdrawal, they require a medical admission and they get supported in that way. That isn't necessarily true of people with opiate disorders, heroin users, even cocaine users or other types of substances.
And do you have any advice for somebody who's on the street struggling and wants to get into long-term recovery?
They can always go to an emergency room, for sure, to get some short-term support. One of the things we do have now are recovery coaches. So people who are in recovery that are familiar with local resources. They can have a different kind of a relationship with the patient than a nurse or a physician can. They can give out their phone number. They can contact patients in between their visits. That's a resource that's available in the psych emergency room and in the medical emergency room. And that's actually a recent development, believe it or not. In all the years that we've been seeing folks struggling with addiction, getting peers involved in helping them is a relatively new phenomenon over the past 5 to 10 years.
Wow, thank you so much. You are the perfect person to talk to.
You're welcome.
Thank you.